All right, good morning, folks. It is 11:03 a.m. It is February 17th, and this is Coffee with Community Services, Alta California Regional Center's weekly vendor meeting. These meetings are recorded, as you would have saw when you logged in, and these end up. Oh, gotta make sure I turn my email off. And these will end up recorded on YouTube, and there's a link on our website where you can watch all of these recordings. And we've got 59 folks on so far. And let me jump into the agenda real quick and some introductions. So let's see. So from our community services department this morning, I see Alicia and Rima. Good morning. And we've got client services manager on Kanisha this morning. Good morning, Kanisha. And I see Heather and Isabella from community services. Good morning as well. And Cindy from client services manager. Good morning. And Christy from Community Services, and our clinical director, Camelia, is on here. We've got our specialized services and supports manager, Jordan, on. We've got Jason from Community Services this morning, and I'm going to ask Jason to give a little insight into all the fun coordinated family support services webinars that he got to participate in this week. And let's see, we've got Veronica, client services manager out of Woodland. Hello, Veronica. Another community services manager, Helen, is on this morning from community services. We've got Shirley and we've got Gary on, and Denise. And let's see, and we've got our community services manager, Michelle Duchesne, on here. Let's make sure we get the last name update correct, folks. So we'll not get too confused. We figured out that there's a whole lot of Michelles that work for our agency. Let's see, and for client services managers, let's see, we've got Faye on. I think I saw Aida and I see Jessica, some of our service coordinators that are on here this morning as well. Client services manager Wyatt is on. I see Christina from client services as well from residential, and Bailey, service coordinator out of our Woodland office. Good morning. I think I caught most of you folks, but we're going to jump into the agenda because we've got a bunch of things to talk about today. So we're going to start with HCBS updates and HCBS grant funds. We're going to talk about the upcoming CPP, CRDP, RFP orientation. We're going to discuss a little bit about what's been going on with coordinated family support services over this last week or so. We're going to be discussing an update about Lyft and Uber and the utilization at our regional center about that. We're going to be discussing the biennial evaluations for vendors. We've got upcoming vendor forums to discuss. And then we've got some DDS meetings that are going to be coming up, and also wanted to share, and I see we have Michelle Ramirez from On My Own, we'll share a little bit about our board of directors tours that we did this week as well, because our board of directors and Camelia was got to go out and for part of the tour that we did at the dental clinic, and we got to go over to Mirasol Village as well. And then obviously, if there's other things that we need to touch on, please don't hesitate to jump into the chat about it. And Rima, Jordan's going to be going over the RFPs for our projects, and so please feel free to chime in and talk about your project that is going to be part of our CPP plan for this year, which we are very happy that the state is funding. So I want to start first by throwing it over to Alicia to give an update of where we are at and kind of the activities that have gone on over this last week. So is everyone able to see some spreadsheets? You guys
Yes.
seeing those? All right. So we have two spreadsheets here. We have the spreadsheet from February 10th, and we have our spreadsheet from February 17th right here. So we are receiving weekly meetings with Department of Developmental Services to ensure that our regional center gets all the way to that compliance that we are looking for. And we receive a daily update from DDS on the status of us and the other regional centers. So, Alicia, last week, it looked like we were at 64% for submitted percentage and 63% for compliance. And I see this week we've moved up to 95% on submitted percent reviewed and 74% compliance. So first off, I would just say a big hand because we are getting closer and closer. So that is excellent. And then Alicia, can you just talk about these activities that have gone on over the last week or so that have helped kind of get us to where we're at right now?
Yeah. So each week I am hosting one-on-one office hours. In the last 5 days alone, I've met with 46 providers one-on-one for about 15, 20 minutes each. and discussed what they need to do for HCBS compliance, what documents need to be submitted. And I get them on their way, and providers have been really good about quick turnaround. We have someone working full time on reviews. So we are caught up with everything submitted to the box. I think we're working on this morning's submissions right now. And we've been sending individualized emails, letters, cold calling, and we have PEC following up with providers as well. So all of that has been very helpful. We also have workshops. We had one a couple weeks ago. We've got one next week and one the week after, where providers can come in and they don't leave until they're compliant, which sounds terrible, but it doesn't take more than an hour to get all those providers compliant while they're sitting there. We send them on their way with their program design addendums if needed, so they can just take them home, file them in the book, and not have to hear from me about HCBS compliance anymore.
Excellent. Well, again, we really appreciate all the efforts to get us, to the point where we are hopefully going to be back up to 100% before we, run out of, till we all turn into pumpkins. But we're feeling like we're on track right now, right, Alicia?
Yeah, we have exactly 1 month until the final rule takes effect, and it is a short month, and we don't even get a leap year this year. So we have 19 more days of work to get everyone compliant. We still have 121 providers who need to be compliant. And we have 18 who haven't submitted documentation, but all but 4 of those 18 have met with us or are scheduled to meet with us.
Again, we've said it multiple times in this meeting that it's unlikely that if you're attending a weekly vendor meeting, and right now we've got 82 of you on, and vast majority being our service providers, you're probably not the providers that are being unresponsive. But we know that towards the end, we've got some folks that are a little bit resistant here. And so, Denise, I know you know some of these folks well, just like I do, that we're still waiting on. So whether it's you and me and Alicia have to go out there and knock on doors ourselves and sit in people's living rooms, we're going to push these last few across the board and get them done. And meanwhile, between Alicia and the temps that have been working with her, there's a lot of progress that's being made. And so I just want to certainly highlight that, and we will continue to keep you updated as our vendor community on what the status is on that. And in the meantime, we're also continuing to look at ongoing ways excuse me, we're going to continue to looking at ongoing ways to ensure HCBS compliance. And part of that is related to the new funds that are available from the state of California. And I think ours was around $980,000 of that. So I'm going to throw it over to Michelle to do a little reminder to folks about the HCBS funds, and to maybe give folks an idea of what kind of proposals we've heard about, if you've taken a look at any.
Thanks, John. So I just touched base with Alicia. It looks like we have 6 proposals that we've received. And I haven't been able to fully review any of those. I'll ask Alicia if she has been able to fully review them at this time. But we were allotted $989,000 to support HCBS compliance. I see that Alicia did put the email into the chat there. So again, just anything that you guys think can help support your programs with HCBS compliance. It doesn't have to be a full proposal, just a letter, kind of what you guys are thinking, and we can, hammer out all those details at a different time. We're requesting that they are provided to us no later than February 22nd. That gives us a little under 4 days to review those and get those to DDS, which they're requesting by the 1st of the month. Alicia, have you had a chance to review any of those?
We got a couple of proposals about work support for individuals exiting school and coming into adult services for the first time. We've had some for programs that want to purchase more vehicles to get individuals out in the community. We've had staff trainings presented, projects that are connected with Department of Rehab to help facilitate extra support in that way for individuals who want to work. There's been a lot of good ideas. We've got housing issues, transportation, mental health support in there. so that individuals can be in the community more. There's a lot of stuff, a lot of great ideas in there.
Yeah, and I think I saw some, purchase of computers and some gym memberships for a year and those kind of things. So I just recommend that. Thank you, Alicia. If you guys just have ideas and you're not sure if it will, apply to this grant funding, just shoot us an email and let us know, and we can chat about it. And there's a lot of options. So again, the email's in the chat and the due date is the 22nd, if you guys can get those over to us.
Awesome. Thank you very much. Thank you, Alicia, for the update. We're going to actually excuse Alicia from the rest of the meeting so she can go do all the million other things that she's got to get done right now. But thank you very much, Alicia, for that update. Thank you, Michelle. And again, we want to see these proposals coming in. One thing that we shared during our provider advisory committee meeting was, there is DSP training that is available, and DSPs can get money from it from the state of California. However, when it was developed, there is no money that goes to service providers to cover for the loss of staff if they are going to take advantage of these DDS programs. And so one idea that was something that Lori Benalis really wanted us to look at, and also with Valley Mountain Regional Center too, we kind of both are looking at it, is the ability to hold off some of this money to the side so that we can pay service providers to release their DSPs to participate in the DSP incentive activities with DDS. So I'm still kind of looking at that closely over the next week or two here, how much money we might need to do that for providers. But again, when you have these opportunities for your DSPs, it doesn't make up for the fact that you still need the employees to provide the direct services for your clients. And if there's time where they're released from their jobs, then that does have an impact on the employer. So I know there was some question at our provider advisory committee meeting whether or not that was something that really is needed or not, or whether or not it was included in the funding that's going to be available from DDS. So I just want to let folks know that has not gone away. We're working on trying to finalize that as well as we go towards the end of this month here. So that is the plan for that. Let's see, Jordan, would you mind, and I think we've got Rima on here still as well, talking about the two different projects that we are looking at putting forth, and maybe you can touch on the home, and then you can maybe have Rima touch on the registry.
Absolutely. Good morning, folks. Happy Friday. So we are very excited, right? It's always an exciting time of year when we get our Community Resource Development Plan approval from DDS. So this year, as John mentioned, we have two specialized projects that have been approved. One is a forensic adult residential facility, really focusing on supporting clients that have substance use disorders, right? They might also have co-occurring mental health disorders, but over the past several years, the regional center and both our community, right, our stakeholders have let us know that we have a drastic need for helping to house our clients with criminal justice involvement. The regional centers are written into the California Penal Code to divert clients with cognitive developmental disabilities. So we have a huge housing need, right, for these clients. And many times, the 4i providers that we currently have vendored might not have serving clients with criminal justice in their program design, right? And we definitely do not have a vendor that solely focuses on substance use disorder and recovery supports for our adult forensic clients. So we're very excited about that. And that will be a 4i. So the special consultants, right, that you would probably see at this kind of home would be more of like your substance use disorder counselors, right, recovery counselors, KDAC certified, maybe LCSWs, things of that nature. So we're really excited to present that. I know that Rima can talk more about the need for our next project, just wanting to let folks know that for the American Sign Language project, we are excited. Rima can go into some more detail about the need of this, but it's really a twofold project, right? Looking at trying to increase the formal ASL interpretation vendors that we have in our outlying communities like Placer, Yolo, Yuba, Sutter, El Dorado, and then also creating a staffing pilot registry, right? And I'll let Rima get into all the cool details about that.
So let me ask specifically a question, Rima. What have you learned through your time here at Alta that makes you think that this is such a necessary service for our community?
Yeah, I'm really so thrilled that this has been approved. So what I've been seeing is as a big issue, and one of the biggest challenges I've been finding from staff is going out to day programs or group homes, and they don't know where they can hire somebody. So if there's a list or something, I'm trying to figure out how we can solve that issue. So getting a registry in place and having a group of interpreters and signing staff. Those signing staff are not interpreters, are not certified, but they can help support with communication access. And those day programs where there's a lot of deaf clientele there, but they're lacking communication, they're isolated. So trying to provide that kind of service to support them with their access needs and their language and their day-to-day communication. And especially with the more rural counties too. I know Sacramento has a large number, but further out, there's not a lot of interpreters available there. So just trying to get this pilot program in place and see what we can't grow in the outskirts. And I think there's having some incentivized monetary, hopefully will help with folks wanting to get more involved with that.
Excellent. Thank you very much for that summary. I, again, really appreciate the collaboration with REMA, working with Jordan's team and being able to put forth a project like this. The Department of Developmental Services broadened the type of services that can receive these types of startup funds to include services to support our deaf and hard of hearing population. And so just really glad that we were able to get the proposal in, that it was approved by the department. And so we will have a request for proposal orientation where we will be talking about this a little bit more in depth. And that's going to be coming up, Jordan?
Yes, it is going to be March 7th from 1 to 2. We are offering hybrid styles. So we will be in the Brenda Smith conference room. But for folks who are not able to come in person, we understand that that's not always an option right now. So we will provide a hybrid link. In order for individuals to apply for the projects, they will have to be present at the public hearing for our request for future proposal for our CPP.
And we're going to make sure that both REMA is there and we have our interpreters as well in person, right?
Exactly. Dee Dee
Okay.
got some dates over to REMA so she could get that scheduled. And we will be sending out obviously a public notice via email so that folks have the link and have all the dates and the data. That'll be sent out on Tuesday.
Again, when the regional centers all adopted the positions of the deaf and hard of hearing specialist at the regional centers, it was not explicitly defined what all of the job duties would be. And so I am very pleased to see like how involved REMA is in like many different areas within our agency. And I'm just hoping that we all take this seriously. Like we have a very large group of people that honestly are under-resourced and underserved. And so again, I appreciate this. And I want to do one other thing real quickly. This is me putting REMA on the spot, which all of you that work for me know I love to put you guys on the spot. But for those of you that are not REMA right now, how many of you feel really good about the word of the week, what you learned in sign language from REMA? Does everyone feel comfortable doing it right now in front of this entire group? I don't see a lot of hands up from our Alta staff. Interesting. So REMA, I'm going to make a request, since every single week you are sending out that new YouTube link to our staff, is for those Fridays where you're here for this meeting, I'm wondering if you would not mind just taking 2 minutes and going over that with our vendor community as well. It's not going to take a lot of time, but I think that is a great use of.
Absolutely, I can do that. Yeah.
Okay,
Yeah.
good. So let's start planning that here as we move forward week after week, and I appreciate that. So we'll give some more refresher training for our service coordinators, community services specialists, and our managers that are here, because if you don't practice it, it doesn't happen. So, all right. Thank you. Thank you very much.
You're right about that. Yeah, that's so true.
All
Yeah,
right.
and that's why I really try to encourage everyone. If you meet me in person in the building, use your signs. Go ahead and practice with me. It's a great opportunity. And there's so many people who are worried about signing something wrong. Just please go ahead. I don't bite.
And I'm like the worst of all of this. And so again, this is why I also want to make sure that we're doing a follow up here in this meeting. And again, just appreciate you, Rima. Appreciate Michelle, who's the supervisor, and us making this a priority for our regional center because it needs to be. So thank you very much. All right. Let's see here. Coordinated family support services. So Jason, you had an opportunity to be able to participate in a couple of different webinars this week, right?
Yes, yeah, I attended on Monday the train the trainer meeting so that I would get a lot more knowledge on the service and then how to be.
Is it me?
Is everything okay?
I don't know. I think I froze up a little bit, but
Oh, okay.
We can go get some-
I attended the train the trainer meeting on Monday just so I could get an overview as far as, being that I'm going to be in charge of those vendorizations for the 076 coordinated family support services. We have some updates. We're currently working on an outreach plan right now to get the word out. On March 1st, we'll be posting on social media as well as on our website our request for proposal. And then on March 16th, we're going to be doing a presentation with the Provider Advisory Committee. John has shared his screen on DDS's website. Here is all the information, and I'll go ahead and put that in the chat as well to the webinar.
so it looks like we don't have the recordings quite yet up from this week's training. So, and again, he just put it in the chat there. So there was a training that was done specifically for regional center staff, like first thing this week. And then there was the very broad community webinars. Many of Alta staff actually attended a webinar back in October about this and had an opportunity to learn a little bit about the service. And that information is available down here. Now there's been more information that has come out. And so we are just internally how we're doing this as well. So as Jason mentioned, externally, we're going to be having the RFP posted. We're going to be obviously meeting with our Provider Advisory Committee to talk a little bit more about this. And we are looking at the supported living services, what do you call it? Program design guidelines, right?
Yes, so yeah, this service was originally tailored after supported living services. Difference being is that the clients are living with their families in the family home. So what we're currently doing right now is we're taking our supported living service program design and we're tailoring it to coordinated family supports.
And for our just internally, so we're going to be, and we'll probably put it on the books today, but we will be doing a question and answer for our managers during our leadership team meeting next week. And I'm going to have Jason and Michelle pop in and do that. Well, Michelle, I guess, would be there anyways. And then we are also going to offer a question and answers time for our service coordinators as well. Because the hope is that people will log in and watch the webinar, or they can view the link to the webinar. But we also want to give folks an opportunity to talk about, well, just that question and answer phase, and it'll help us because we're still trying to understand fully the service and what this pilot looks like. And Jason and we'll have an opportunity to get feedback from the department about this as well. So if we can get questions that come from managers, if there's questions that come from our service coordinators, the hope is that we can get those things answered from the folks at DDS. And by having just one kind of point of contact person, the hope is that we can be very congruent with our language that we're using as far as this. Saying SLS in the family home is a pretty good descriptor per se, but with the trainings that went on, this can be, it can be a direct service. It can be more like facilitation. I know many of you are aware of our coordinated future planning initiative at Alta California Regional Center, which many of our managers and directors participated in, lots of clients and families as well. And one of our big pushes for that coordinated future planning initiative is to make sure that we have a caregiver succession plan. If you live with your aged caregiver, you know, who's going to be the next caregiver? What is going to be in your future, and how can we go out planning it? Well, coordinated family support services could be someone that comes in and helps you with that plan. And being able to offer it at $58 an hour is pretty good. And we also know that there's an opportunity for the rate to go up, I think about another 10% than that if there is some reporting requirements that are met for providers as well. And I think that information is already on DDS's website. They've got a little bit of information there in their frequently asked questions. They'll be adding more and more, I'm sure, to the frequently asked questions and putting that out there. So let me just see if anyone has any initial questions about this service, or more than anything, we just want to make sure that you guys take a look at the RFP when we put it out and can, you know, answer some questions at that point. We are trying to make the program design requirements as easy as possible. This is a pilot program at this time. There might be things that do end up getting changed when it becomes a, you know, kind of like a regular ongoing service, but we do already have a service code for it. So that's already a pretty big deal. So again, Jason's can put his email in the chat as well if you have some specific questions at Alta related to it. And then just for all the Alta staff that are on from case management, you know, Jason is transitioning into the lead position in community services, and this is going to be his baby. This is going to be his responsibility to roll this out to vendors. And so we're very excited about that. Appreciate Jason taking on this responsibility, because, you know, a brand new type of service doesn't happen that often. Well, I should say it used to not happen very often. Nowadays, I feel like we're getting new types of services, you know, a few times a year. But now we've got a good point of contact, like I said, at Alta, and we'll do our very best to make sure that we can provide the information to you. Provider Advisory Committee, I think, is going to be a great spot to get info, because by then we will have completed all these webinars, and then we will have an opportunity to really discuss it in depth with our vendors. We would love to see a number of vendors come forth wanting to offer this service. And especially in our outlying areas, and especially people that are willing to serve families that don't primarily speak English. That, I mean, I'm not saying that we're going to go any slower vendorizing people that don't do that, but we will certainly put a precedence on getting vendorizations through for people that are serving outlying areas and that are willing to provide this service in a different language. Because that's kind of one of the big aspects of this project. So, all right, very cool. Yes, it is very exciting. And yes, congrats to Jason. Jason has been an extremely hard worker over these years in our community services department. And we're very happy to have him being able to move into this lead position. And we found a person to replace him. Well, I don't know if replace is the right word, but to fill the position that Jason was in previously. And so that person will be transitioning over once we figure out the exact date. But in the meantime, Jason's taking on some of these enhanced responsibilities. All right. I want to move from there to, I guess, more happy type of news. I want to share my screen, and let's see, and maybe Michelle from On My Own can weigh in if she's still on here.
Yeah, I'm here.
All right. So what did you get to do on Tuesday?
I got to go on a field trip with some of the Alta board members and some of the Alta staff to tour 2 places, big projects that Alta has been working on for, gosh, years now. One was the Marisol Village, is the apartment complex over there off of 12. And then so that's where we are right there. We went and toured the units. Oh, goodness.
Oh, there's all kinds of close-ups. Don't worry about it. Don't be embarrassed.
Yeah. Those are the Michelles.
I said Michelle's. I want all the Michelle's to get together, and they did for this. So Michelle Ruwitz is here, one of our board members, and then obviously Michelle Johnson, our Director of Client Services. And they got to tour a unit that is actually going to be occupied by one of our clients probably in the next month.
Really cool. Yeah, really nice apartments. And the one that we're in right now is an ADA apartment. So you can see that area where he's circling right there, where you can a wheelchair can wheel up and you can work at the counter. The bathrooms are all equipped with all the proper handles and bars and things like that. It's just a really nice facility. They even have a community garden and a walking path.
What's this? This is the wading pool, right? They have like a
Yep.
kiddie pool. So
Kiddie
there's a
pool.
big pool that's right next to it. And then they have this very shallow kind of wading pool, which is really neat right there. And this is Dan Kilmer, who comes down to these meetings very frequently when he doesn't have his AWS. And Dan, from all the way since he didn't even have a ponytail in his hair, has been working on getting this project off the ground and has really done a fantastic job. And so kudos to Dan, not only working on all the contracts with the developers, but also working with all of the clients to get them into the lease up. So this is one of the guys from the construction company who gave us all a tour. I think we look really cool in our hard hats. This is Dan Lake and Kelly Pennington. These are our board members. Michelle, I mentioned earlier, and obviously Lori. There's a big community garden that is part of this. And you can see, I think there's a picture. Yeah, there you go. So Mirasol Village Community Garden. And again, what a great opportunity for our clients to be able to go over there, grow fresh fruits and vegetables, literally, 20, 30 yards away from where their apartment building is. So we really enjoyed the tour out there. And we got to also go over to, and I'm going to stop sharing my screen real quick. We also got to go over to our dental clinic. And so I will pop open the pictures from the dental clinic as well. We'll see how well those show up. All right, so let me share my screen here. Oh, I shared the wrong screen. I don't want to share that screen. Nope. I want to share this screen. 1 second. All right. So this is inside the Halo Sacramento Community Clinic's dental clinic. So we had in the morning, we were over at Mirasol Village, and then we transitioned over to the dental clinic. And the nice thing is that they're both about, less than 3 miles away from our office. I think that the Mirasol Village is about 2.5 miles, and this one's about 1.5 miles from our office. So very close by both of these projects. This is inside one of the dental operatories or dental rooms. And what looks different about this than a typical dental room is that this is not a dental chair, but this is what's called a VersaTilt. And so you can roll your wheelchair directly onto this, and it will tilt you back while you're in your wheelchair. So just wanted to kind of show folks the interior and see what it looks like. We have, let's see here. Oh, another picture of the interior. Uh-oh, it's loading super slow. This is a large room that we have near the front of it, which we are working on getting some dental desensitization activities into this particular room. And so I know our clinical staff is looking at having some partnerships with some behaviorists so that we can utilize this space. This space at one point was going to be a pharmacy over there, and they've decided not to put the pharmacy in. And so they're opening up a portion of this space for our use as well. And you can see Camellia there, who has joined us for this tour, and also Shannon, our dental coordinator, which I, every day, am so pleased that we have added this dental coordinator position because there's so much that you can do if you really understand the science behind things, which was kind of sorely lacking with us over the years. We didn't have that type of dental expertise. And also, she's a very creative person too, which I really like that because she's got tons of great ideas. So this is, again, the Sacramento Community Clinics right there on El Camino and Evergreen. So people joke around because I do have a telescope that's in my office, and I can see the top of this building from my office window. And I unfortunately had to watch for years while I waited for them to get it open, and they finally did. And this is on the interior. There's lots of seating inside of here, and then you have the dental side on one side, and right across from us it says medical, and that's where the medical side for the dental clinic is. What I would say is certainly look forward to additional information coming out from Alta related to both the Mirasol Village project and for our dental clinic, letting folks know kind of what would be the best use of the dental clinic and how we're looking at transition or moving folks in through that dental clinic rather than continuing the long wait that we have for sedation dentistry and for Dr. Begao. So again, I appreciate everyone that was able to come out for the tour. We really appreciated getting the tour from the staff from Mirasol and from the dental clinic, and more to show about that. But these projects that Jordan's team, works on putting together are awesome. Sometimes they take many years to get done, but when they do, you get something like Mirasol Village where you've got 15 units that are set aside for people with developmental disabilities, and they will only be paying 1/3 of their rent, which will cover both, 1/3 of their income, which will cover both their rent and their utilities. And we have a restrictive covenant on that property so they can only be used for people with developmental disabilities for the next 55 years. So for the next 55 years, that owner of the property cannot rent out those units to anyone other than our clients. And that was the condition for us paying state funds for those units. So to me, it's a fantastic use of kind of like one-time state funds. And it really opens up opportunities for people to have some real stability. As we were walking around Mirasol Village and talking about it, we need 50 more projects like this easily to get things going. And we're working on doing more and more of these types of housing projects. But again, just wanted to share some of the updates and good news, and appreciate our Michelle and the rest of our board members. Many of you should know, we always have a provider advisory committee member. So we always have one of our vendors that is there on the board as well. And they're at our board meetings monthly too. So thank you very much, Michelle, for coming out for that. And we'll look forward to sharing more updates. We should have most folks moved in the next month and a half or so. PAC meetings are on the second Thursday of each month at 9:30. That's right. All right, let's see here. Let me go next on my agenda. I want to touch on biennial file reviews. So let me share my screen real quickly. Everyone's really excited about paperwork. Okay, so we are required, and many of you are aware of this as service providers because you've received letters from your specialist or from our vendor processors in the past to update your information in the OIG portal, Office of Inspector General portal. Well, we are required at the Regional Center, and trust us, we recognize it because we're in the middle of our DDS audit right now. We have DDS auditors right on the 6th floor with our community services staff and accounting staff. And in that, we are required biennially to do a file review. And this, some of you might remember, was one of the findings from the state auditors when they came out last year, was that the regional centers were not across the board doing biennial file reviews. And it is important to ensure that we've got your contact information up to date, that we know who's part of your business. I think it's Denise right now that's dealing with a service provider of ours that decided to change their corporate structure without letting us know or community care licensing know. And unfortunately, when we found out about that, then they forfeit their license in cases like that. If you're a residential service provider, and we want to be mindful that the information that we have is up to date. And so this document just talks about the things that are required, making sure that we have current, complete, and accurate information for your vendor packets, making sure that you've served at least one person in the last 24 months. From time to time, if we have a kind of an obscure service that we don't use very often, we might keep it on our vendor panel, even if we haven't used it in the last 2 years. Some of the like whole person assessors that were more popular vendors years ago are still on there, but they're not used very frequently. And so we've kept some of those on. But in actuality, we really should not be keeping this big, long list of all these service providers if they're not still providing services to our clients. And so we have our staff going through right now and doing these biennial evaluations. So if you get contacted by, I think Dasha's the lead right now, Dasha as one of our vendor processors at the vendor processor desk is going through and reviewing and making sure that you guys have this. So please be responsive to them if they are making these requests. The Department of Developmental Services certainly got a talking to by the state of California for not having the regional centers doing these, and hence the reason why this directive was turned around and given to the regional centers to remind us of our responsibilities to do the biennial evaluations. And so again, nothing per se for you to do other than to always remember that if there's some substantive change that's being made with your company, please reach out to your community services specialist and let them know. Many service providers have been very good about that, but then there's some that have really struggled in keeping us up to date, and we want to make sure that we do have that up-to-date information for folks. All right. And as I mentioned, the DDS auditors are here as well. So that may mean, and I know it's already happened with some vendors, we might be reaching out to you to try to gather some missing document that we might not have in the vendor files. This is certainly common when we have the auditors come through. All right. Lyft and Uber. So we've been having discussions over the last couple of weeks about how we can overcome our very large transportation challenges that we're facing. I want to give an update. I don't want to actually give this update at all, but I'm going to give this update, which is kind of where we are at with transportation right now. Certainly important. Our managers need to know about this as we get ready for our management meeting next week. So we have 253 new TSRs that we are in the process of matching with clients right now. We are processing through January 15th through January 31st. So if you had a start date for those days, we are still matching those clients right now. What I learned is that we have about 150 declines from our transportation providers. 103 declines that Tanya's processing, and I think Ka has 45 that she's processing. And we certainly understand if we're talking about wheelchair transportation, the challenges that are tied to that, the necessity to have an aid on transportation. But we are really, really struggling with being able to rebuild these routes with the number of declines that we are receiving from our transportation providers. And so I know I see a bunch of your guys' names on here right now. If you are a transportation provider and you feel like, hey, I've got the capacity to do way more, and I'm not one of those people that would be declining, you guys know how to reach out to Ka. You guys know how to reach out, to Transportation POS. You know how to reach out to Tanya. Marty's still kind of new and is kind of figuring out the transportation coordinator role. But I do want to encourage you service providers to please reach out to our transportation coordinators, because if we have 103 declines, that's 103 basically brand new TSRs that we have to go through and find additional transportation for. And I know I had an opportunity to discuss this with DDS this week, and DDS, their question was, is there, the new monthly rates, and how is it that the new monthly rates are going to be able to impact this? And we've had two vendors that have expressed an interest in utilizing the monthly reimbursement rates, and have returned back the documentation as appropriate to initiate it. But again, I don't know that there's anything inherent in having a monthly reimbursement rate that is going to increase people's willingness to accept more transportation routes. I know when I dive in and take a look at where the challenges are or where the complaints are coming in, it's clients that are attending like 2 days a week, half days. And again, that's a big challenge to build a transportation route around individuals that are attending such a short amount of day programming. So as we are continuing to address this issue, we are working on operationalizing the ability to have service providers arrange for rides for clients to and from their day programs or to and from their work activities, and be able to be reimbursed on a 024 reimbursement through the regional center. We are finalizing the directions on how we are going to do that. We have a meeting with Carol, I think at 3:00 today, and to put the final touches on some of the ideas related to this. Again, Michelle, we've got an attestation form that we're working on. DDS definitely wants to make sure that if we do something like this, it's short term and only specific to the specific kind of emergency need that we have right now for transportation. And then we're also looking at a program design addendum that we can throw on for providers that are going to be willing to do this, right? That's the second piece.
Correct, yeah. And we had a client acknowledgement as well, just to ensure it's person-centered in their choice.
So we're not wanting to make a bunch of paperwork up or make it that much more onerous, but we do believe that utilizing these ride-sharing apps might be able to provide some, and we already know that there's a number of providers that are already providing this for clients. And we do feel that there are certainly providers out there that know whether or not an individual would be appropriate to participate in a ride like that, or those individuals that might need that closed transportation and might need the aids, for example, or might need a wheelchair. So again, more to come on this. I understand statewide we have a lot of challenges as it relates to transportation, and I'm hearing it from the other regional centers as well. But this is a process that we are, kind of going to be moving forward here on a temporary basis, I think for the next 2 to 3 months, so that we can at least get people back into their programs as much as possible. And so we will have some information to kind of formalize that with our service coordinators and client services managers and everyone as we kind of get the last little pieces of it, figured out. So just you'll receive, basically you're going to get weekly updates on transportation in this meeting until we can get back to where we feel like we are actually meeting the needs of our community, which we're not meeting our needs right now. That is not happening. So we need to, we're going to keep providing you the numbers, where we're at as far as the dates for scheduling. And just please know, we have not only the transportation coordinators, we actually have another temp as well, who's working with the transportation coordinators to be able to process those transportation service requests a little bit faster. But again, when we have so many declines, it really makes it a challenge to be able to do things like rebuild the routes. All right. We have upcoming attestation document. Yeah, okay. We have upcoming vendor forums. So Helen, you've got one for infant development programs? Oh, you're muted.
Yeah, I have for infant development programs, vendors, the vendor forum is March 14th from 1 till 2:30 in the afternoon. And the flyer is available on the website for that vendor forum. Now for the individual therapist and agency vendors, I don't know if we have any here. The vendor forum is March 21st from 1 till 2:30 in the afternoon. And we are in the process of posting the flyer for that. It will be done today.
All right, and then Michelle, we've got ICF vendor forum coming up, right?
Yeah, we also have Adult Day and Employment, the 23rd of this month from 10 to 12. And I believe the ICF is March 7th.
That sounds right. So again, this is related.
March 7th at 10.
March 7th. Yeah, we typically do them at 10 a.m. I think, for the Adult Day and Employment, certainly a lot of discussions about, I'm sure Tailored Day services are going to come up. I'm sure talking about the, return to days of the, days of the week, possibly discussions about the state of emergency going away and the impact of that. There is been ongoing directives related to the state of emergency that have been continued kind of month after month. And I will just share, those all go away at the end of the month when the state of emergency goes away. So all of the things that have been approved. But since then, some of those things have been codified into law, right? So one of the early things was looking at Early Start and looking at the ability to do those services remotely. Well, now that's something that has been, written into the Welfare and Institutions Code. So it's law now, for example. So again, those are going to be going away, but COVID itself and the impact certainly has not gone away. I think I had COVID just, not, it was just a few months ago, but not too long ago. And we're certainly still getting people that are testing positive for it and certainly still having impacts related to it. But you will have to stay tuned about what additional opportunities the department gives. One thing we know we have a bunch of supported living vendors on here. We did reach out to the department to get more clarification on those isolation rates for COVID-19. And we believe that those are going to go away along with the state of emergency. But I just want to let folks know that we're still trying to get a little bit more confirmation from the department on that. And I think they've been unresponsive, and I'm going to try myself maybe today to try to get a better response from them so that we can come back to you as service providers and let you know what the plan is there. I'm gonna go over to DDS's website real quick and just talk about some upcoming things that are happening. Let's see here. I know we've got a number of people. Let's see. Are you guys seeing DDS's website here? I know we've got a number of people that are part of the Developmental Services Task Force work groups. I know Garrett and I think, are on the Safety Net one together. I know Lori Benalis is on the DS Task Force Community Resources work group. So if you plan on attending this, this information is publicly on DDS's website. We will, and actually it'll be myself and Jim Morgan, who's the manager at DDS that oversees the multifamily housing projects. We're going to be talking about our Mirasol Village project. So the one that you just saw pictures of, we're going to be doing a presentation to the Developmental Services Task Force Community Resource Development Work Group on February 21st. I'm pretty sure I'm triple booked at that time, but it's only like 5 minutes long. So I'm going to pop out of whatever meeting I'm in, and we're going to do a presentation on Mirasol Village. But a good opportunity if folks want to hear about different types of housing and kind of some activities that are going on statewide. This is an opportunity, and it's an open meeting that people can attend as well.
Can you put the link to that in the chat, John?
I will, yeah, absolutely, yep.
Thank you.
All right. So yeah, again, certainly want to encourage folks to participate in these statewide meetings. I know they had the employment committee meeting as well a few weeks ago, and still ongoing discussion about the implementation of our employment grant. We are going to be focusing on employment a lot during our next newsletter that comes out. And so Carly is gathering pictures and stories of clients that think of like pre-vocational all the way through like competitive integrated employment. We're looking at pictures and examples of people receiving those types of employment services. I know it came up during the Provider Advisory Committee meeting, asking that. I know that I've seen that some pictures and stories have kind of rolled in from different service providers related to that. So again, just want to really celebrate all the things that are going on right now. If there's a way that we can, steer people towards employment that maybe would not have thought that it was available to them, what a great way for us to, really implement what should have been, been going on the last 10 years, right? This is the 10-year anniversary for Employment First in the state of California. So I think there's a great opportunity that Lori wants to highlight that in our newsletter. We're also going to be highlighting that by talking about our strategic plan activities that are tied to the employment as well. And so again, if you have some stories, and then I know that Shirley and Michelle will be reaching out because we need an artist as well. We need an artist, and preferably someone that sells their art that we can highlight for the newsletter this time around too. I told Michelle that I was going to remind her about that, and now I'm reminding her in front of everyone here. And then hopefully we can get one of you providers that would be interested in emailing in to Shirley or to Michelle, someone that you'd like to highlight. To me, it is, I hate to say highlight again, but it is like the highlight of the newsletter to me to read the stories about our talented clients at the regional center and be able to hopefully help them, make some profits off of selling their art by getting their name out there. And so, and I see Jody in there. I don't know that we've featured, our folks from Moore up there. So that might be a great option. So Michelle's got her email in there, and we're going to keep doing this for our newsletter and moving forward. We're going to have these opportunities. So as much as we can, share that. Also, I opened this up during the Provider Advisory Committee meeting, and I think I said it here too. If you've got a picture of like some awesome training that you did in person, all of your staff are there, or some event that occurred out at your agency, and it's something that you might want. I think I had Dream Theater in last time, some pictures from the parade that they did. Again, we probably won't be doing a whole big full page thing about your agency, but I'm really happy to throw in a couple pictures to celebrate some of the things that you as providers are doing with our clients out in the community. So for that one, I saw my assistant Zach on here, and so Zach can throw his email address into the chat. If you send it to me, my email is typically always full, too big to send emails out. And so we can make sure we got Zach Horch at altaregional.org, and I'll put that right there in the chat. There it is. And then Zach did as well. And we both spelled it right, which is really good. Okay. And then I know, Jody, there's a question there about minimum wage. Do you want to unmute real quick? And so we can talk about that. I think the minimum wage increase is, I think the way we figured it out is that they're going to be added up on top of the 25, 50% rate increases that you've received already. All right. Well, then that's the answer to that. There should not be, I hope, any issues with people's billing that they had for the month of January. We haven't heard widely that there was problems. I know that there is some vendors that have reached out to us to ensure that they were categorized correctly when it comes to the day program. And so poor Jason and Michelle and myself have been reading these this last week and trying to figure out, did we categorize every day program appropriately and make sure that we are applying all of these rate increases. And so just want to let folks know that we are going to give another look back at these, that we've been communicating a bunch with UCP about their day programs. And so we're just going to do a little look back, a little double check, just to make sure there is not any other issues. We certainly haven't had issues that have been identified by you all as service providers that have not been addressed, but we're just going to be doing kind of one more check of them over the next couple of weeks to make sure there's not any issues with that. All right, so we've got Shirley's information in the chat for the arts and crafts ideas for the newsletter, and Zach's information in there if you want to talk a little bit about what's been going on, with your agency, and maybe have a picture or two that you might want featured in our newsletter. We certainly be very, very interested in that as well. All right, so for our small agenda today, that brings us to 11:59 a.m. And thank you, everyone. We got about 90 or so that logged in today. And we'll be meeting with folks again next week. We'll have some special presentations about things, I think, next week. A surprise special presentations that people will learn more about next week. So look forward to talking to folks, and have a great weekend. Alta staff, please take Monday off. And I think the day programs, other close, unless you do residential. Residential, you don't get weekends off and you don't get holidays off. But for everyone else, you certainly do. So take care of yourselves, and we'll look forward to talking to folks next week.
Bye.